Department of Obstetrics and Gynecology at the University of Arizona promotes a wide range of women's health care and has the most informed medical leaders in the community. All faculty are dedicated to the educational, clinical, research, and outreach components of the residency and fellowship programs.
The University Medical Center is a teaching hospital. As residents, we're trained to take care of women through every phase of their lives, from childbearing through midlife through postmenopause. Each one of us is mentored by a nationally recognized physician in the area of women's health.
We're learning every day, whether we know it or not. We learn in the OR, during lectures, during rounds, but most of all, we just learn by doing. And before we know it, we're teaching medical students how to do their own deliveries. We can answer all their questions about preterm labor or PPROM, preeclampsia, or whatnot.
The mission of the Department of Obstetrics and Gynecology is to promote excellence in the healthcare of women. This is continuously demonstrated to our patients as we learn how to provide the best clinical care available to women today.
At our program, patient care is learning. Our attendings make sure that we are learning when we are performing patient care. And at the heart of our program, patient care is number one. Quality patient care is really caring about the whole woman as a whole person, not just the illness that she's having or the troubles that she's having at that point in time. It's really caring about the woman as a person.
As part of our training, we get to work with faculty members who are well-renowned, and we are part of academic research that is really on the cutting edge.
During our residency training, residents have been involved in randomized controlled trials, clinical research, and educational research. They've also had opportunities to present at national conferences and publication in national journals.
The topic of my research was looking at education among primary care residents regarding emergency contraception. What we were looking at is basically how much information they know so they can share with their patients.
Residents that are here now were interns when I started, and to see their development over the last 3 years is amazing. It really is incredible to see somebody who doesn't really have the knowledge. When they see a patient, they're not really sure what to do with them. And then at the end of the 4 years, to see them become these incredibly skilled surgeons, it's very rewarding.
I think that residents really keep you on your toes, and so they challenge me to know all the new things that are going on in gynecology and also to know exactly what I'm talking about.
I had a resident that I went to Vietnam with some years back, and we would always be welcome to have residents come. My trips to Nicaragua or Honduras, Peru, they're always open to it, and I know that other residents have traveled with other attending.
Teaching the surgical procedure is really important. One of the good things about laparoscopy is that every procedure can be recorded and it can be edited into teaching videos.
The Department of Obstetrics and Gynecology strives to be among the best resident education programs in the nation. Please make a contribution to the Resident Education Fund at the University of Arizona. Your support will go towards purchasing new and innovative resources for learning and capital costs for improving resident learning environments. Making a contribution is easy. Go to www.obgyn.arizona.edu. Click on the banner that says Ways to Give. All information submitted is secure. Your tax-deductible contribution will make a positive impact in the teaching of future obstetricians and gynecologists.
It's an excitement in a completely different way. You take somebody whose mind is like a little fledgling in the nest, and they want every bit of information that you can give to them. And it's exciting to see that transformation and then see the finished product 4 years later where they're really accomplished surgeons.
We are the physicians of tomorrow. We are the future.